If you're anything like me, like learning anatomy through sports injuries, this is episode 78, and this is Séamus Coleman, March 25th, 2017. Next episode will be the most liked suggestion, so now is your chance. Let's take a look at it. Wales, Ireland here, and Séamus is going to try to make a pass, but he gets tackled and instantly grabs his leg, and his teammate even knows something is wrong. So let's take another look at it. As he goes for the pass, the defender's boot makes contact with just above the ankle, and that's not good if you are Séamus Coleman. That is an extra bend below the knee and above the ankle that you are not supposed to have, and instantly grabbing it is a telltale sign that something is wrong. So let's take a look at what happened. Well, it was a tibia fibula fracture, the shin bone and the small bone to the side of the shin. It was an open fracture, kind of a Kevin Ware situation, which means it was a bone poking out of the skin. So this is dangerous, of course. And an immediate deformity was seen, as we can see in this photo here. This looks to be the shin guard, and just above the shin guard is where that deformity starts. And there's the knee and a deformity below the knee and above the ankle. You're not supposed to have that, as we know. So ankle involvement as well. Syndesmosis disruption was involved. So that's the ligament or the fibrous material between the tibia and fibula that hold the two together, and a deltoid ligament stress due to the severe tackle here. And this footballers have so much force when they're going for a kick. He broke his own shin basically. Plus the momentum of the defender coming towards him, it didn't really work out the way that they had expected. So danger is neurovascular compromise and compartment syndrome, as well as infection risk. Okay, so with an open fracture like this, grass and sweat and things like that can get into this open fracture or wound. So it needs to be taken care of quickly, which they did. They did an emergency surgery to pin everything back together and close him up. So, like I said, they stabilized the limb on the field. They had to stretcher him off. Not my traditional favorite stretcher here. This one is not the deep one that we see commonly now. Nonetheless, neurovascular assessment on the field just to make sure that he has blood flow to that lower leg, which it seemed like he did. IV antibiotics to try and prevent infection as quickly as possible, and a transport to the hospital where they did that surgery, which was an open reduction internal fixation. Basically, that just means plates and screws inside of the body, nothing outside of the body. Post-op immobilization and non-weight bearing up until he gets to physical therapy, which you would progressively weight bear and lead into sport-specific training, which took about 9 months for them to rehab. And of course, now he's playing for Everton. So that is Séamus Coleman.